Namaste and welcome to yet another episode of the Hypospadias series. We are going to continue with the technique known as flip flap, which was originally described by Mathieu. Now, to get an overview, we must remember that this is a single stage procedure which is used for cases of distal shaft to mid shaft hypospadias. Now, in this technique, what is important is that there should be good ventral skin because that is where we will be raising the flap from. Now, whether degloving is required in the entirety of the shaft or just enough to release the cordy is debatable. Some centers prefer to release it completely. Some say that a complete degloving is not required. But as per the original description, what you need to remember is that if this is the opening in the present situation and this is where we need the urethral meatus to be, suppose it is a length of x, so we need to know this length and width, because equivalent to that we are going to be raising a flap from the ventral skin which will be incised down till the subcutaneous region. Now, once these incisions are complete, and this is the circumferential extension which helps in the degloving, this shows that the flap has been freed completely. Now, in the next step, we see here this is the draining tube, which can be the silicone catheter or the infant feeding tube as convenient, and this is usually inserted at the beginning itself. For more information, you can see the peri-operative considerations that I have described in the previous videos. So this is showing the draining tube, and this is showing that the flap is going to be flipped over by almost 180 degrees, and that is why it is known as a flip flap procedure. And then this is going to be sutured onto itself with the tube in the center. So for example, this is a very rough description, but if this is the opening of the urethral meatus and we need it to be at the tip, and we have the draining tube right here in the center, we have raised the flap, made the incisions, and it is going to be flipped onto itself. And once it is flipped onto itself, it is going to be sutured on the sides to get the closure, and then the remaining skin is closed by closure of the glandular flaps, and then obviously correcting back the degloved penile skin, so it leads to a final scar appearing like this. Now, like most of the procedures, with time there have been many modifications where waterproofing can be done with the inner preputial flap or with the dorsal flap, and there is also a description wherein it is known as the dorsal tip meatotomy in the flip flap technique of Mathieu. So that is done because if you see here, this is going to lead to a very oval or a circumferential looking urethral meatus, and normally the one that is considered near normal is slit shaped. So in those cases, what happens is that you need to make a dorsal slit, and that meatotomy is done, and the rest of the flip flap procedure is performed. So those are the two modifications that you should be aware of.